Hi there, my name is Eric Ansart, and I'm with Lympha Press. Thanks for taking a couple of minutes to share with us today. Every patient dealing with lymphedema has a different story, which is why at Lympha Press, our goal is to put all of the necessary options for treatment into your hands. I recall meeting Andrea for the first time. She was frustrated and she was afraid. She had acquired lymphedema from a simple infection in her leg, and for years she had been shuffled from doctor's office to doctor's office, and when I first met her, she was close to giving up. The saddest part to me is that she was trying to keep her condition a secret. She was no longer asking for help from friends and family because she felt like a burden, and she had completely given up going out with friends and socializing. At Lympha Press, we believe that every patient's treatment should be as unique as the people we serve and the stories we hear. Whether you are where Andrea was in her life, or if you're just hearing about lymphedema for the first time, you deserve to have equipment that works for you. Over the next 20 minutes, we're going to share some of the unique ways we've come to serve our patients. If you're a clinician and you'd like to hear more about the groundbreaking research, you can forward directly to minute 15 and we'll focus on our clinical study. But before we get to the details about our customized therapies, we want to start by sharing some testimonies from people like you and me whose lives have been changed by Lympha Press.
Crushed by heavy equipment on the job over 15 years ago, he was told there was no hope and no answers. This is what Derek's lower extremities looked like. And these are the shoes he had to have specially made to accommodate what was really a round foot and ankle.
The orthopedic shoes were ugly, and we talked about them. They were supposed to work for him, but they were like big iron balls. He was walking around. We used to call it Frankenstein.
6 months. Within 6 months, I started seeing results. My legs started going down. The ulcers, because I had very large ulcers in my legs. The ulcers start slowly getting smaller, and it was a miracle. It's a miracle. When I first was seeing Christian, it was this big. And now you can see how small it is now.
Our patient files are filled with thousands of testimonies just like Derek's, of people who have found relief and help and improved quality of life because of Lympha Press. Here are just a few. I am so grateful for my pump. I've suffered with lymphedema my entire life and have never been so surprised or happy with the results. I have been happily wearing my boots twice daily since receiving them. My legs are doing quite well. I wish I had them years earlier. They might have prevented several serious lower leg wounds that took months to heal and countless doctor's visits and prescriptions. Thank you. I absolutely love the pump therapy. It has decreased the swelling in my legs a lot. I'm able to get back into my slacks and jeans that I couldn't with the swelling. My feet and legs feel absolutely wonderful after each treatment. I love the pump and compression therapy. It has been such a wonderful experience. Your representative was very professional and friendly. She took her time explaining and ensured we understood everything before she left. This is the second time I've had to be in the wound center because of cuts and tears on my legs that wouldn't heal. The pump helps my legs relax and takes the swelling out of them and circulates the blood in my legs. I use it every day and it helps tremendously. What about when a doctor becomes the patient? Dr. Nalini Mehta is a radiation oncologist in practice for over 30 years. She specializes in the treatment of breast cancer.
I've always used compression therapy on my patients, breast cancer patients in their, upper extremities. And about 2 years ago, I was diagnosed with sarcoma of my right leg and had extensive surgery and radiation therapy, and did have trouble with wound healing, as well as swelling of my right leg. And one day I did talk to the rep and who had come to see how our patients were doing, and I was telling him, and I'm very used to using compression therapy on the breast cancer patients. And while I was talking to him, and we both thought, gee, can you use that in the leg? And figured, why not? And so I got the compression therapy machine and started using it. And my incision, or the radiated area skin, which hadn't healed in about, I think about 9 to 12 months. Most of the healing had occurred, but there was one area that just wouldn't heal. Even though I had hyperbaric oxygen treatment, a lot of other, wound care, and I started using this compression therapy just so that the swelling will go down. And surprisingly, within few weeks, of course, the swelling went down the first week, but the skin that wasn't healing started healing. Looking back, it made all the sense, because once the swelling is down, the blood supply improves in that area. Your skin is not stretched, and so that helps healing.
Now that you've heard what patients have to say about LymphaPress therapy and how it has changed their lives for the better, take a look at some of the tools we provide to improve quality of life.
LymphaPress offers a variety of compression pumps, easy to use in the comfort of your home. Here are some important facts about LymphaPress compression pumps. First of all, the LymphaPress completely inflates during the initial cycle, and its rapid treatment cycles provide more therapy rotations in less time than slower filling systems. All LymphaPress devices have a treatment timer that can range from 15 to 90 minutes with auto shutoff. And every LymphaPress can treat patients bilaterally, which cuts treatment time and increases compliance. The LymphaPress pressure locking mechanism protects the system from accidental adjustments. And using smart technology, LymphaPress systems fill to fit each patient's size for exact pressure. The adaptive pause program assures complete deflation between compression cycles. LymphaPress garments easily attach to our compression pumps, and our unique garments are one of the features that make LymphaPress compression therapy systems so effective. We feature more compression cells, up to 24 chambers in each garment, fully overlapping compression cells. Our patented system for smooth and effective therapy does not produce backflow or gaps. LymphaPress is proud to offer a wide selection of individually adjustable, adaptive garment sizes for a perfect fit, and the garments are easy to put on and remove. Our non-stretch fabric, user-friendly design, and dynamic compression ensures that the patient will get excellent treatment every time. We offer complete solutions for torso, trunk, and genital areas. These are just a few of the features that add up to the LymphaPress difference.
We take pride in providing outstanding pumps and garments that really make a difference for the patients we serve. We take pride in our relationships, not just with our patients, but with our healthcare providers as well. Here's what doctors have to say about our compression therapy.
Well, after breast surgery as well as radiation, sometimes there is about 15% risk that patients will develop lymphedema in their arm, and so we recommend compression therapy to decompress the edema, and their quality of life will be maintained, and they'll be able to do everything they were doing before the treatment. And even though I've been practicing for 30 years, I didn't really realize how cumbersome that swelling is. It's almost like you're carrying that extra 10-pound weight in your arm or in your leg. And just decompressing that swelling can make so much difference.
I like to use anything that's available to me. Obviously, I'm using my standard, foam, bandages. I'm doing my manual massage. I definitely use compression pumps in the clinic and also for home use. It just really helps me to kind of affect the change in the tissues a bit better to help kind of bring a leg like that down to the point where I can kind of mold it a little bit better with my massage and just make my bandages even more effective so that I can help to shape that limb a little bit better and get where I need to be.
They used to think of edema as just getting the fluid out of the leg and getting the swelling down. But so many things are associated with the buildup of fluid in the leg. One is when there's too much fluid in the leg or too much fluid in the outflow system, nothing can get in. It's like squeezing a hose at one end and then the fluid comes down and it can't get through the other end, which is closed. So in order to make sure that a limb has good blood flow, good arterial flow in, good flow of fluids around to the cells and to the other organs, and then good fluid exit from the limb so that the waste products that are created by metabolism and other things going on in the limb are removed, you have to have a good, you can't have a lot of edema in the leg, so you have to have good removal of that fluid. That's done by two systems, the venous system and the lymphatic system, and pumps help both to eliminate fluid from the leg. When you eliminate fluid, you reduce kind of the back pressure in the surrounding tissues to a wound, and you actually increase the microcirculation to the surrounding wound. All wound healing happens at the edge, and it heals inward toward the center. So if you can reduce the pressure at the edge and increase blood flow at the edge, then you'll see increased healing in the wound.
We treat a large volume of patients with swelling or edema of the lower extremities, and that the lymphedema pumps that we sell would certainly assist in the healing of these wounds. I've seen the product firsthand. I opened up a lymphedema program at the hospital, and I'm proud to say we're one of the few facilities where inpatients can be offered this form of therapy. And so I actually do place the devices on patients myself in the hospital, so I see firsthand. And it gives me a better understanding of the mechanics of the device and how it works in certain individuals. I think if you choose the right individual and if they're compliant in using the machines, the results are much better. The outcomes are much better. Wounds tend to heal, and wound healing is only the first priority. The second and third priority is keeping patients free of wounds and keeping them out of the hospital. There's no question that with a comprehensive form of treatment where you focus on the wounds, focus on lifestyle changes, and assist the patients with these pumps, that their wounds do heal quicker.
This particular quote comes from a recent study that showed how effective LymphaPress is. Dr. Carolyn Fife says, "Thanks to the innovative engineers at LymphaPress who created the sleeves for the pneumatic compression device, we can actually see in real time the way the LymphaPress device can activate the lymphatics to enhance lymphatic flow. This validates what we understand clinically, that patients improve when they use the LymphaPress pneumatic compression pump." Before we look at some of the groundbreaking research, I want to finish that story about Andrea. Andrea's been using her LymphaPress pump for over 5 years now, and there have been a lot of changes in her life. Her edema is much more manageable, her wounds have healed, and she's back to work. LymphaPress is a product that worked for her, and maybe it's a product that'll work for you too. In our company, we like to reference this study as "the green dye doesn't lie." That might sound funny to some of you, but for us, there's been so much speculation in this industry about whether or not lymphatic fluid and the proteins associated with that fluid move into the patient's lymphatic system when they're using a compression pump. I think we all took a deep sigh of relief when for the first time any device was able to show lymphatic uptake in a patient's limb that is truly affected with lymphedema. We feel like this is groundbreaking research and really something that clinicians around the world and patients should take a fresh look at. In September 2016, the Journal of Innovative Optical Health Sciences published an article called "The Effect of Pneumatic Compression Therapy on Lymph Movement in Lymphedema-Affected Extremities, as Assessed by Near-Infrared Fluorescent Lymphatic Imaging." We would like to thank the facilitators of this study, along with the numerous institutions that were instrumental in collecting and evaluating the data. In addition to being published in September, the results of the study were also presented at the 2015 World Congress of Lymphology in San Francisco. This is the first study, to our knowledge, to provide visual images of lymph movement during pneumatic compression in the affected extremity of a patient with lymphedema. In the study, we worked with 4 patients. All the patients had been previously diagnosed with lower extremity lymphedema, and we chose to include all of our findings. Patients were injected with IC green dye, which is a glow-in-the-dark dye that can be seen several centimeters under the patient's skin using a special camera. The expert engineers at LymphaPress designed transparent garments so we were able to see what was taking place inside of the patient's leg while using the LymphaPress pump. Not only did the LymphaPress help to improve lymph flow, but because the proteins were marked with a dye, we were able to prove positively that the LymphaPress compression pump helps to move proteins through the patient's lymphatic system. We've already seen an overwhelming level of support from lymphedema therapists who are excited to hear this news. In fact, since this World's NLM conference in Dallas, Texas, we've received many supportive comments from the vascular and lymphatic community. In the following slide, you're going to see some of the specially designed garments designed by the engineering team at LymphaPress. Our engineers designed garments that had transparent pockets and windows so that the images would be visible for us to see. Before treatment, there was little or no lymphatic flow, but during treatment, you can see that there is fluid moving through the intervascular space and through the patient's lymph vessels. Contraction rates also increased during the treatment time and remained increased throughout the treatment time. On the far left of this picture, you can see a patient who was injected with the dye prior to using a LymphaPress. The slide on the right is after the use of the LymphaPress, and it's apparent that the dye is moving through the intervascular space as well as through the lymph channels. The speed of pulsation also increased during the use of the LymphaPress device. You can see that there is fluid moving through the intervascular space and through the patient's lymph vessels. These vessels are seen contracting and moving small pockets or packets of lymph fluid through the patient's valves. It's incredible in this slide to watch the lymph fluid actually moving through the patient's lymphatic system. We appreciate Dr. Carolyn Fife's comments, where she said we have actually seen in real time the way LymphaPress devices can activate the lymphatics and enhance lymphatic flow. So in conclusion, this is a groundbreaking research study because while the benefits of LymphaPress products have always been obvious to most clinicians and to most patients, this is the first time that the impact on lymphatic flow was actually seen in action. We were able to see the speed of pulsation in the lymphatic system increase during and after LymphaPress treatment. Time between pulsations also increased during treatment. Distal to proximal lymph movement was shown in the interstitial space, and lymph vessels propelling lymph fluid in synchronization with the pump cycle. Thank you so much for joining us here today. Hopefully you got some new information. Maybe you learned a couple of things about how you can treat your own condition or take care of the patients that you serve. If you need anything from us, you can always look us up online or just click one of the links right here on this page. Thank you from everybody at LymphaPress.